My name is Jane Garibay. I am State Representative for Windsor and Windsor Locks, the 60th District, and welcome to On the Porch. Today we are here with a couple of guests from the Department of Public Health, Commissioner Renee Coleman-Mitchell, and we'll introduce Barbara Cass-Always, who works in that department, and we have Eric Weiner, who is a Windsor citizen, my go-to person for statistics and tech consultant. Welcome, everyone.
Thank you. Pleasure to be here.
I want to thank you both so much for coming on. As you know, and you hear it all the time, that people have lots of questions, especially in Windsor, with Kimberly Hall per capita having the highest death rate. We appreciate everything, and as a legislator, I know all the hard work that our commissioners and our commissions are doing to help us through this. So having said that, we wanted to just talk to you a little bit about what's happening out there for nursing home support, et cetera. Eric, do you want to start with the first question?
Sure. And it was great to hear yesterday in the governor's press conference that the National Guard is now supplementing the DPH staff in terms of conducting inspections. I'm really pleased to hear that you guys can get a little bit of relief because, boy, my heart goes out to the effort that your team is putting in. Just wondering whether those inspection results will be made public, and so that families can get some feedback from the state how the facilities might be that are taking care of their family members.
Absolutely. First and foremost, my heart goes out to the families that have lost loved ones and continue to worry about those that are in facilities that are COVID-19 positive. It hits home for all of us on many levels. So my heart goes out. Secondly, in the midst of this pandemic, we have talked quite a bit within the department about how we no longer can do things the way we've done it. And we have to kind of up our game and be more consistent with providing technical assistance and boots on the ground. And so we have been doing above and beyond the work that we normally do in regards to the Department of Public Health, monitoring our sites and offering technical assistance and working with them. It's wonderful to have the National Guard on board. That is wonderful and added resource that we definitely need. And at the same time, I want to put the bigger picture out there that the challenge has been when you look at the country, the United States as a whole, and the fact that as a state health officer for the state, for public health, and having conference calls with other state health officials that serve in the same capacity. One of the things that we have struggled and continue to, as of even yesterday, when we had our nationwide call with all the state health officials, is the nursing homes. And it's a struggle. And so we have really tried to say, what can we do differently, not the norm, in a pandemic, and try everything that we can with as much resources as we can. So with that said, I want to defer to Barbara Cass, who's our branch chief for facilities and licensing and inspection, and talk a little bit about all the work that she and her staff have done just with infection control, PPE, and staffing. And then we want to share, if we can, a little bit about the nursing home surge plan that we've put in place to address the anticipated surge that we're expecting in a couple of weeks in the state, and helping to decompress the hospitals and have people have ability, once they're being discharged from the hospital, going to a step-down type of COVID recovery facility, and what that means for our nursing home residents and Connecticut residents in general. So thank you for at least allowing me to speak on that. Barbara?
Thank you, Commissioner. So I do want to underscore Commissioner Coleman-Mitchell's comments. We remain very concerned about our nursing home residents. We are continuously reevaluating our plan and what we can do to perhaps continue to reinvest all of our resources towards our nursing home plan. We know I never thought in my life that I would be living through a pandemic, And while there's an overuse probably of the term unprecedented, we truly are in unprecedented times. So the commissioner so eloquently said we're learning every single day. Every single day, the information that we learn causes us to pause, evaluate, and maybe modify our plan a little bit. Nursing homes right now, the healthcare workers are doing a very, very heavy lift, and we are so grateful for the work that they are doing. I'm happy to report that we have been in all 215 nursing homes in Connecticut. We have conducted a focused infection control survey. And with that infection control survey, we are looking at many systems that include lots of observations. We're looking at in-service training specific to infection control practices. We're talking with residents and staff, and we're not just focusing our survey on nursing staff. We're also expanding and going beyond that scope to housekeepers, floor porters, people who are doing very critical, important work with cleaning and disinfecting the environment. We're also looking at the dietary services and what is the kitchen or the dietary service doing to, number one, ensure compliance with infection control, and what principles are in place to ensure that there's surveillance going on from the infection control nurse so that there could be in-time training with all of the staff. Mr. Weiner asked a question about our findings. We have had some findings in our nursing homes, and our practice and the federal laws and state laws require us to submit a violation letter to the facility. They have 10 days to provide a plan of correction. Once we approve that plan of correction, our findings are then publicly disclosable. There is a due process in place if a facility should disagree with our finding, but typically that does not hold up our disclosure process. We have every day we're trying to do something different so that we can reach out to nursing home residents, reach out to families. This is a very difficult time because we do have a ban on visitation. However, that ban on visitation has been a critical, integral approach to the mitigation measures to hopefully reduce the incidence in the facility. And as holidays and very special holidays start to approach with Mother's Day and Father's Day coming, the commissioner's been actively involved with other state agencies to hopefully bring families, and it may be virtually, but bring families to their loved ones in nursing homes.
Yeah, sorry.
Sure. Mr. Weiner, I could talk forever. So.
Actually, I wanted to prompt you along those lines because I've been thinking a lot about emotional support for the residents and their families and the staff in the nursing homes, because they're going through something that it'd be impossible to be adequately prepared for. Is there any thought on how the state can assist with emotional support, initially at least for the residents, calling in reserve psychotherapists, as other locales have done, things along those lines?
Can I just interject for one moment? And I know Barbara will have much more detail than I. With the nursing home surge plan, it's been really a collaboration, not with just the Department of Public Health, but also the Department of Social Services, as well as the Department of Aging and Disability, Office of Policy and Management, and the Unified Command out of the Governor's Office. And we've talked a lot about how there's more facets to this than just the monitoring and the work that we do at DPH.
Yeah.
There's also the ombudsman. Right? Absolutely, it really is a full spectrum of opportunity to try to make a difference. And so with the ombudsman, Mairead Painter, under the leadership of Commissioner Amy Porter at the Aging and Disability Department, we continue to have daily calls with all of the partners that I mentioned, 8 o'clock every morning, to kind of talk about all of the pieces that we bring to the table on behalf of not only the nursing home residents, but their family members as well. And one of the key things that has been shared is that Renee Painter out of the Department of Aging and Disability has many ways in which she connects with the families and the residents, and also brings their concerns to the table when we have our 8 o'clock calls. And so one of the biggest things is that she has Facebook Live that she does a couple times a week, a lot of participatory events there with having that Facebook Live, but also opportunities to talk about the impact that all of this is having on the residents and their families, and the communication that she continues to really pursue to connect families and residents, but also the concerns that we as DPH have that that's not always happening across the board with
Right.
all of the facilities. And so there's that ongoing communication daily at the 8 o'clock meetings from Aging and Disability about the concerns and how do we move forward. Just as an example, as Barbara stated, is that we're looking at how do we, for Mother's Day, even Father's Day, how do we have people and families and residents come together in a situation of a pandemic, because we come from that public health perspective, right? And really have an opportunity for families to finally connect, even if it's maybe beyond virtual. What are some of the restrictions and guidance as DPH that we would provide, so that could make all the difference in the world. And then also for me as a commissioner, I just actually hung up with Commissioner Miriam Delphin-Rittman from DEMAS, Department of Mental Health and Addiction Services, talking about getting services in and how do we address that. Again, challenged because you don't want a lot of footprints in the nursing homes because of the concern for transmission. So that is an ongoing topic that we have, and we have to try to use opportunities. We are trying to gear up again for Mother's and Father's Day. How do we make a difference in these people's lives so that they can finally see and be with and speak to their loved ones? And so there's ongoing communication there within our group, again, with the ombudsman, Renee Painter, being the lead in terms of how we can go forward with that, with guidance from DPH in terms of restrictions regarding, safe distancing, masking, and all the above. Barbara, I know she can add a lot more.
I've heard a lot of comments from fellow citizens in Windsor asking how they can help. There is a reserve corps of kind-hearted souls that, whether it's bringing food or arranging so that everybody has a tablet to do the virtual meetings.
We need tablets. Honestly, we're really trying to look at technology. How can we improve on that and get more of that? We really do need that. If there's any way that tablets can be utilized, I know that, Barbara, you've seen that happen. You want to kind of talk about that as well. And we do need volunteers. I know the Medical Reserve Corps is through our local health department, so the health director in Windsor would be the perfect person to start there.
But is there a place for lay people like myself that just want to go in and volunteer? And it's hard because I've had the virus,
Yes, I've heard your story. Wonderful that you're back and talking about it.
Can I, they can't tell me 100% that I can't get it again now. We think that we're free and clear for 2 to 3 months. But is there a place for volunteers that can take on the piece of connecting people through Skype or whatever with their loved ones? Because the medical staff is so stretched and doing so much. And I know it's hard, but is there a place, or possibly in the near future?
Barbara, do you want to?
So we do have a automated website, Connecticut Responds, where volunteers could go in. It's an automated system and volunteer their services. And the volunteers are shared at the local level, and then they become the Medical Reserve Corps. So they are looking for lots of different skill sets. I also know that there's work being done right now with preparing nursing homes for Mother's Day and Father's Day. So the long-term care ombudsman program may be the point of contact for that. There's lots of work being done to how can we assist with getting window visits. I have a personal connection, and this was a resident, her daughter, who every day went to the nursing home and did a window visit. And I was so touched by how important that was to not only the resident, but her daughter.
Yeah.
So there's lots of work that's being done right now to encourage window visits, encourage bringing technology and doing FaceTime, even if a facility doesn't have a computer, bringing that cordless phone to the resident at the bedside so that they can speak to their loved one. That connection, we know, is critically important now more than ever.
What is your suggested way that a concerned relative or friend of a resident contacts the nursing home? How do we make that happen?
So they should be working through, if it's a family member who has a resident in the nursing home, they should be calling the unit directly. They may have to go through the receptionist.
Sure.
That may be the point of contact initially, but speaking with the nurse and arranging that visit, whether it's a window visit or if it's a phone visit or an electronic visit. Start with the nurse on the unit. If that's not successful, then reach out to the social worker or the recreational therapist. I'm confident that that first point of contact with the nurse will be effective, but I like to build a bench.
Yes, thank you.
Okay, I want to ask, which I'll call the difficult question now. I get so many calls. As you know, per capita, Windsor has the highest death rate at Kimberly Hall in the state. And when we're talking about it, I know there's so much unknown, and I think, well, is everybody reporting the same? Every nursing home? Is our population higher, older, not higher, older? You know, it could take me, myself, I know with the virus, and I was kind of self-quarantining when I caught it, you know, is it just one person going in and they went to, you know, these rooms? It's as easy as that. And I guess someone has to be top in the state. But what can you tell me? There's a huge concern, and I've worked with Kimberly Hall for 20 years in my past position with the Chamber of Commerce, and I always found them to be caring, upright, etc. So I believe nursing homes in general are trying their hardest to do the right thing. They don't want bad results.
Right.
How can you answer some of those questions? People are just, you know, is what I said, is it because, you know, they have an older population in that wing with the Alzheimer's? Are people reporting differently? Because I heard some nursing homes report, you know, cases that have been tested, but others, they know the residents were sick with it. You can tell, you know, basically tell. I'm sorry.
So, no, it's perfect. I think that what we need to do is set the parameters, knowing this. Nationwide, countrywide, the most vulnerable populations are our nursing home residents because of the age and the comorbidity that exists, first and foremost. There are several priority populations here in Connecticut. So it's the nursing home community, assisted living community, anyone really in congregate settings that is older and have comorbidity. And then some of our underserved, underrepresented communities in the state, our Department of Corrections. These are numerous, right, vulnerable populations right now. Excuse me, dry cough with the weather change. That's so one of the biggest struggles is that when you see the entire United States lit up in red regarding nursing homes, we're no different than any other state, and the struggle to address it. Once it's entered into a congregate setting, it is extremely challenging to really mitigate the transmission, but it doesn't mean we're not trying to not stop it. But it's challenging, and when you have one of the most vulnerable populations in itself being in that congregate setting, and the virus is entered in it, the transmission, it spreads like wildfire. And it's been a challenge, but there's been a number of things, because for us to do nothing is the worst thing. So we've been trying to do as much as we can, reevaluate, change up what we're doing, and try to continue to reassess. So you mentioned Kimberly Hall. That is a difficult topic. I'm not going to lie to you.
Right.
I know people.
And you may not be able to answer all my questions on it, and I understand that, but that's what I'm hearing from you.
Yeah, it's devastating. So I know that we've gone in and we've done our assessments and worked with them, and it still has grown. But I want to defer to Barbara directly, because she and her staff are the ones who have gone in. But no, the bigger picture, it is on the radar of the governor's office, our team here, And yet again, it's the population that we're trying to figure it all out. And there have been some really good things that we're trying to do. And it doesn't mean we're going to stop. We're going to continue doing it. And knowing that this is such a fluid and dynamic process with this pandemic, our goal is, okay, does this work? What else can we do differently to make a change, make a difference? It doesn't bring back those who were lost in Kimberly Hall. I recognize that. But it doesn't mean that we haven't tried to do as much as we can and still continue to do things differently, and having more of a direct contact with the facility, the healthcare workers. We've been communicating with the union on behalf of the healthcare workers and continue to try to make change. It doesn't give the answers that people want to hear, but we're working on it. Barbara, do you want to really delve into what we've done and what we're going to be doing as well?
Because I understand you also have web classes you're giving now in nursing homes. I've heard how fabulous they are.
Ah, good.
You might not know how to put on your gear, or how do you take off those gloves and dispose of them. So I'd like to hear more about that too.
Barbara's the perfect person.
So Commissioner, thank you for the reference about a wildfire, because we hear that, that's a recurrent theme that we hear, that it starts as a spark and then it's a wildfire in a healthcare or a congregate setting because of the virulence of the infection. And as the Commissioner indicated, this is our most vulnerable population with comorbidities. So the incidence is very high when it gets into a building. And again, we are so sorry for all the losses of those family members. But we did have lots of conversation, lots of consultation with Kimberly North early on in this, and we did have 2 on-site visits. So during those on-site visits, we did identify that staff were doing what they needed to do. They did have adequate staffing in place. They did have adequate PPE. And it's also, the Commissioner indicated earlier in her remarks that we're doing things a little bit differently. Pre-COVID-19, we didn't have that deep consultative role. But at this point, we are providing deeper technical advice as it relates to infection control. And this is a perfect segue to our virtual trainings that we're doing. We started them a week ago, and it was very important for us to touch those healthcare workers who are at the bedside and help them to understand how to don and how to doff. And we know if we say something and reinforce it, it will become a habit. So we are going to continue to do those, and they're 10 to 15 minute FaceTime sessions. And then we provide the people who are watching, the caregivers, the real boots on the ground people, the opportunity to ask questions. So we're really excited about continuing this. And the nursing assistants and nurses have had amazing, outstanding questions. So that's going to continue. Thank you.
That's great. So can you tell me, do they have, I can't imagine being in the nursing home and you become attached to your patients no matter how hard you try. Is there mental health care for the workers in nursing homes and elsewhere in hospitals to help them deal with all this pain and dying? Or is that through their insurance, or is it different? How are we helping them to get through this?
So it's different at every organization. Residents are getting their psychosocial needs met through consultants who all nursing homes contract with a psychiatric service, and resident needs are currently being met. I would suspect that peer-to-peer support is incredibly helpful right now. I think we're all feeling the psychosocial impact of what's happening with social distancing, just having to wear a mask. All of our lives have changed incredibly, and I think we have all developed our own unique coping mechanisms to get through this very difficult time.
Thank you, Eric. We're getting close to the end time. Do you have any last questions you'd like to ask?
Yeah, just following up on what I was talking about earlier. What are the requests that you have of the people of Windsor and surrounding towns? Put us at your disposal.
I have to say, as Commissioner, we continue to want to hear directly from your constituents, our residents, about their concerns. We're a public health officials, and we're about the public and protecting their health and safety. So I don't want people to hesitate. People have been contacting us via email or calls, and I still encourage them. We work for the people to make it happen, right? So I want to make it very clear that when we do get concerns and complaints, and generally in writing, it's best because there's so many,
Right.
we take those seriously and read them. And then normally if they come to me, I directly connect with the particular section or branch that oversees that particular topic. So if we're talking today about COVID-19 and the concerns during the nursing homes, they go straight to Barbara's branch, and then her staff follow up on them. And it's been 9 times out of 10, when I get the concerns in writing, I've been able to say, okay, we send it out. What's the status? Can we get somebody out there? This is a complaint. And her staff have been able to say, we've already been most times, right? Because it's on someone's radar. And
Is there an
they talk
email
about
address
finding.
you'd like to provide?
The general one for my general email address. Oh boy, it's Renee, RENEE Coleman-Mitchell at ct.gov, the one that would be on our website. And I will tell people I have been inundated since the beginning of COVID-19, and I do have a generic email saying, have patience, I will get to them as I can.
Right. I know I'm getting like 150 a day, so I can't imagine what you're getting.
You have no idea. And people do get upset you haven't responded, or they'll contact, governor's office. And I'm like, right, Barbara, we're doing the best we can in light of all of this. But I don't want to in any way say that we're not open to hearing from people, suggestions. And that common cliche, we're all in this together, it really is. We're all in this together. So we're very open to ideas and suggestions and recommendations, being that this is all new to us.
Right. So
Barbara?
We also have a DPH. So one of the sections in my branch is called the Facility Licensing and Investigation section. And the acronym that we use is FLIS, F-L-I-S. So if there are complaints, concerns that anyone would like to send in electronically, I always tell people just Google Connecticut DPH FLIS complaints, and it brings you right up to the webpage.
Oh, that's great.
And there's an electronic form that you can complete. And I firmly believe that the work that we do in the Facility Licensing and Investigation section is a quality assurance arm of healthcare. We do affect change here, so it's important. If the consumers out there have concerns, we do want to hear about it.
Well, I want to thank you all for being here, and thank you, Eric, for co-hosting today. I know if I have one ask, it's telling people stay home,
Yes.
the social distancing, and wear the mask. It's
Absolutely.
Because you think you don't need it. It's you're protecting other people. And it's such an easy thing to do they say it's like protects like 95% if you're wearing your mask. So that would be my ask of the public, is wear your mask, stay home. Soon enough, we'll all be working like crazy again and being out there. So try to enjoy it a little bit. Any last comments, Eric?
I'm fine, thank you.
Okay, thank you.
Yes, nice to meet
Barbara.
you, Representative, and nice to see you again, Eric, and hopefully in the future in better conditions.
And
Yeah,
thank
great.
you all for
Yes.
your work. We
Yes.
know you're working so hard, and we just really appreciate, we really appreciate all the work you do.
Thank you for this
Okay, so
opportunity.
thank you, everyone, for
Thank
joining
you.
us on the porch.
Stay
Until
well.
next time.
Yes.
Bye-bye.
Bye-bye.